Hello, Kiran. You're a bit early for your appointment and you look worried. How can I help you?
Hello, Dr. Nitin. I'm early as I was worried about a few things. As you can see, I've lost my front tooth and have a big presentation in 2 months' time. I needed some advice on how best to replace this tooth. One of my friends suggested an implant. Therefore, I've come to you for advice on dental implants. Doctor, please give me some details on tooth implant.
Kiran, I'm so glad you have come to me with these queries. It is very important for you to know about implants before making your choice. As you are aware, the tooth portion that we can see outside is called as a crown. The hidden portion which acts as an anchor to this tooth is called a root and is embedded into the jawbone. A dental implant mimics this system perfectly, where a metal piece acts as a root and supports the tooth. In short, tooth implants are an effective way to replacing missing teeth and are designed to blend in with your other teeth.
How is this different from the usual tooth replacements?
Kiran, when a tooth is lost, the supporting bone tends to shrink, and even though we replace with other options like a crown or a bridge where we take support of other teeth, the underlying bone will continue to shrink and alter the contours of your face. Bone loss will make your face look aged. When we have a tooth implant in place, it preserves the bone. If you compare the various options of replacing missing teeth, you can make out several advantages. A tooth implant gives you full chewing ability, preserves the surrounding healthy teeth, and also stops bone loss. If you opt for a crown and bridge, it will mean that I will grind healthy teeth to take support and the bone loss under the missing tooth will continue. Hence, I feel for you. A tooth implant is the best solution to replace your missing front tooth.
Doctor, thank you so much for clarifying my doubts. How long will it take for this implant procedure to be completed?
Kiran, we will first need to take some X-rays and also tooth models in order to evaluate the quality and the volume of bone available for implant. Following this, any other existing dental problems will be treated before undertaking an implant procedure. The procedure itself will take anywhere from 30 minutes to 2 hours, but it will take about 6 weeks to confirm if the implant is blended in with the bone. There are 3 stages to placing an implant. Stage 1, implant placement, where the implant will be placed into the underlying bone. Stage 2, integration phase. This is the time taken for the implant to blend in with your bone and typically takes about 6 weeks to 6 months. Stage 3, restorative phase. Once the implant is blended in, the missing tooth structure will be placed onto it.
Doctor, are there any risks with this procedure?
Like with any procedure, there are certain risks. If the implant does not blend in with the underlying bone, then there may be implant failure. This depends on the oral hygiene maintained and other factors like whether you smoke and have any systemic disease. However, we will evaluate the quality of your bone before placing an implant. The success rate of a dental implant is generally 95%, so you may rest assured.
Doctor, what if my bone quality is not good?
Kiran, if the bone quality is not good, we will try to increase the volume and quality by harvesting bone from elsewhere in your body and increasing the height of your bone in your jaw. Generally, this may be required in older people and will take 3 to 6 months for the new bone to be ready for implant.
Doctor, thank you for explaining these important points. How long will an implant last?
Kiran, this will depend on how well you maintain oral hygiene. Once the implant is blended into the bone, it will last as long as natural teeth, provided adequate hygiene is maintained.
Thank you so much, Doctor. Please tell me when I can come in for implant fixation.
Tooth implants are an effective way to replacing missing teeth and are designed to blend in with your other teeth. The quality and the volume of bone available for implant will determine the success of the procedure. Talk to your dentist before making a decision on replacing a missing tooth.